Kidney disease is becoming one of the world's fastest-growing causes of death. The alarming part? About 90% of people have no clue they're affected. In this video, we'll walk you through 8 signs that could signal something's off with your kidneys, and they need some attention. Stick around to the end, where we'll share a few easy tips to keep your kidneys in top shape. Your kidneys are like the body's personal filters, positioned on either side of your lower back. These incredible organs get rid of extra uric acid, help balance essential minerals like calcium, sodium, and phosphorus, and even keep your blood pressure stable. They're also responsible for making blood and managing hemoglobin levels, and they activate vitamin D from sunlight or food so your body can actually use it. When the kidneys start to struggle, all these vital functions get thrown off. The tricky part? In the early stages of kidney issues, symptoms barely show. By the time it's detected, the damage can be as much as 80%. But don't worry, by staying a bit proactive, you can catch the warning signs early and give your kidneys the support they need. Symptom number 1, foamy or bloody urine. One of the most dependable signs that something may be wrong with your kidneys often shows up through changes in your urine. Typically, most people go to the bathroom about 6 to 10 times a day. But if you find yourself needing to pee much more or less often, especially if you're waking up several times during the night, this could be a warning sign. Sometimes, people feel the need to urinate but then barely produce any urine. This uncomfortable, incomplete feeling might point to a kidney stone blocking the ureter. Blood in the urine, known as hematuria, is another red flag. It can be linked to kidney infections, tumors, stones, or even kidney failure. If kidneys aren't filtering properly, blood may leak into the urine, turning it brown, red, or even purple. Women sometimes mistake this for a menstrual issue, but it's important not to overlook it. Symptom number 2, fatigue. Our kidneys work hard to filter out all the toxins in our bodies, so when they start to struggle, impurities begin to build up in our blood. This can leave us feeling exhausted, weak, lightheaded, and even make it hard to focus. On top of that, healthy kidneys produce a hormone called erythropoietin, which helps create red blood cells. Red blood cells are crucial because they carry oxygen to all parts of the body. When kidney issues lower the red blood cell count, there's less oxygen reaching our organs, which means less energy for us. This is why persistent fatigue, even after a full night's rest, can be an early sign of kidney trouble. Urologists explain that when kidney-related tiredness sets in, even simple tasks like taking a bath or walking just a short distance can feel overwhelming. The fewer red blood cells, the more drained and fragile we feel, often leading to anemia. Since fatigue can stem from various causes, getting a blood test can help rule out other possibilities and ensure you're on the right track with your health. Symptom number 3, swelling. If you're waking up each morning with puffy eyes or notice your ankles are swelling, it's something to pay attention to. When kidneys aren't working as they should, they allow fluids to build up in the body. On top of that, damaged kidneys can lead to excess sodium in the blood, which holds on to fluid. With kidney issues, gravity tends to pull this fluid toward your lower body, causing swelling in areas like the legs, ankles, feet, or even hands. Swelling in the extremities isn't always just a kidney issue, though. It can also indicate liver, heart, or chronic vein problems. Low levels of a protein called albumin may also lead to swelling, as albumin plays a role in keeping fluid balance in the body. Since both kidneys and liver help regulate fluids, they're closely linked. So, if you're experiencing persistent swelling in these areas, it could be a sign that your kidneys need a checkup. Symptom number 4, shortness of breath. Shortness of breath is often linked to heart or lung issues, but it can also be a symptom of kidney disease. When the kidneys can't filter out fluids and toxins, they can start to accumulate in the lungs, making it harder to breathe. On top of that, a reduced red blood cell count and anemia from kidney problems mean less oxygen is circulating through your body, leading to that feeling of breathlessness. In severe cases, even lying down can feel overwhelming, almost like you're struggling to catch your breath. If you experience this, it's crucial to see a doctor right away. Symptom number 5, dry and itchy skin. One of the kidney's essential roles is purifying the blood. When they can't perform this task effectively, it often leads to symptoms like itching. Beyond just filtering toxins and aiding red blood cell production, the kidneys also maintain the right levels of bone minerals. So, when kidney function starts to falter, the body's mineral balance gets thrown off, leading to dry and itchy skin. As toxins build up in the bloodstream, they can trigger various skin reactions. Some people may experience itching in one area, while for others, it spreads more widely. Skin tone can even shift to a yellow or brownish shade, signaling hidden toxins in the body. Interestingly, around 10% of kidney issues are actually detected by dermatologists. So, if you've had ongoing skin issues that don't respond to usual treatments, it might be worth considering a kidney checkup. It could be your body's way of signaling a deeper issue. Symptom number 6. Bad breath and metal taste. People with kidney disease often report a metallic taste in their mouth and constant bad breath. They might also lose their appetite and find that food doesn't appeal to them. These symptoms result from the buildup of toxins in the blood, especially a compound called urea. This can cause bad breath and lead to nausea or even vomiting, making the thought of eating unappealing. If you're experiencing these symptoms, it's essential not to wait. This is the time to consult a doctor. It could be your body's way of signaling that your kidneys need attention. Symptom number 7. Trouble sleeping. When kidneys start to fail, they can't filter out toxins effectively, leaving them to circulate in your bloodstream and disrupt various bodily functions. One significant impact of this toxin buildup is poor sleep quality. Many people with kidney issues struggle to fall asleep or stay asleep, and it can even lead to sleep apnea. Sleep apnea is a condition where breathing repeatedly stops and starts during sleep, often causing loud snoring. In some cases, it can become obstructive, blocking airways and making restful sleep nearly impossible. If you notice persistent sleep issues or symptoms of sleep apnea, it may be worth checking in with a healthcare professional to see if kidney health could be a factor. Symptom number 8. High blood pressure and diabetes. While they may not be direct symptoms, if you have high blood pressure or diabetes, you're at a higher risk for kidney disease. In fact, high blood pressure is the leading cause of kidney failure in 40% of cases, and 1 in 3 people with diabetes experiences kidney damage. When blood sugar levels spike, it thickens the blood and can damage the tiny blood vessels in the kidneys. Similarly, high blood pressure can harm those same delicate vessels. It's a two-way street. Kidneys help regulate blood pressure, so when they fail, high blood pressure can be a result. To keep your kidneys healthy, managing both your blood pressure and blood sugar is crucial. Early signs of kidney issues often go unnoticed until significant damage occurs, usually around 70 to 80%. However, with some proactive steps, kidney damage can be reversed. First, stay hydrated. Doctors emphasize that dehydration is a major contributor to kidney stones and infections. Aim for 4 to 6 glasses of water a day. Warm or hot water is especially beneficial. In a study, kidney patients who drank a liter of hot water within 30 minutes saw a 20% reduction in creatinine levels and a 40% decrease in urea levels. Next, be cautious with medications. Overusing non-steroidal anti-inflammatory drugs like ibuprofen and naproxen can harm your kidneys. Antibiotics, while effective against infections, contain toxins that can put a strain on your kidneys, especially if they're already compromised. Always consult your doctor before taking medications like penicillin or sulfonamides if you have kidney issues. Regular exercise is another cornerstone of kidney health. It helps maintain optimal blood pressure and benefits your overall well-being. Whether you enjoy running, cycling, swimming, or simply walking, incorporating daily exercise can have lasting positive effects on your kidneys. If you're over 60, were born with a low birth weight, or have a family history of cardiovascular disease, make it a point to regularly check your kidney function. Preventing complications is always easier than dealing with them after the fact. Remember, our kidneys are nature's powerful detox system, often overlooked until something goes wrong. So, keep an eye on these signs and consider lifestyle changes to support your kidney health. If you found this video helpful, don't forget to like and subscribe to the channel. Sharing this information can help others take better care of their kidneys too. Still hungry for more knowledge? Dive into the next video on your screen. We're confident it will be just as enlightening. Thanks for tuning in. See you there.